Hey everyone, what's up? It's Austin Fair, physical therapist at Fenix Physical Therapy and Performance. And recently I've got a handful of messages to me asking, why does my shoulder hurt? Or where's my shoulder pain coming from? It's really hard to diagnose just off of answering a few questions because the shoulder joint is actually pretty complex. It's a ball and socket joint, but it has 17 muscles that cross over it and that are involved in the motion of it. Some primary movers, and then there's some auxiliary movers too. But what I wanted to do is go over the two most common injuries because the way they get injured are pretty much the same. And so what we'll do is we'll go through the anatomy of the shoulder, and then we'll talk about some different ways that they get injured and then some ways that we can treat it. So the shoulder joint is comprised of this bone here, the humerus, and we'll turn it around, and this bone here, which is a shoulder blade or scapula. And as we zoom in here, it creates a ball and socket joint. So here's the socket right through here, and the head of the humerus makes a ball. What's worth mentioning is the shoulder has a roof, basically, that is partly made by this part of the shoulder blade and also the collarbone. And that plays an important role in why shoulders get injured the way they do. So, as far as muscles go, we'll talk about the rotator cuff muscles. There are 4 rotator cuff muscles. There's this one underneath called the infraspinatus. Then there's the teres minor, the infraspinatus, and the supraspinatus. Now, fun fact is when people say that they injured their rotator cuff, like 95% of the time, it's this muscle right here, the supraspinatus. And the reason why is because this muscle is in such close proximity to the roof here. So let's take a look at the way the shoulder moves. The job of the rotator cuff muscles is to make sure that the ball stays right in the center of the socket. And as you watch this move, you can see how the shoulder just rolls up and rolls back down. And it stays right in the center of the socket. The injuries that are most common are rotator cuff tear and shoulder impingement. And what happens there is, for whatever reason, sometimes a weakness in the muscle, or a muscle pulling too much, or firing is too early or too late. But inevitably what ends up happening is that the shoulder ends up bumping up against the roof, just ever so slightly, enough to where 1 or 2 times it isn't going to irritate it, but hundreds and thousands of repetitions can start to irritate it. And it's a little bit more likely to happen the older you get, and I'll show you why. As we zoom into the shoulder, naturally with friction what happens is there can be tiny bone spurs that begin to pop up underneath the roof here of the shoulder. So as we change it, you can kind of see, or you can begin to see how if there's a smaller space available for the shoulder to move, that there can be more friction. And because of the rubbing over time, after thousands and thousands and thousands of small little irritations, what can happen? Whoa. Let's do this. Let's move the shoulder first. There we go. There can be these tiny microscopic tears in the tendon, which usually aren't a big deal, but it's the repetitive rubbing up against the top that continues to bring on the pain. And if you could get the shoulder to not do that anymore, to get the shoulder to stay perfectly centered in the socket, you're going to be okay, even though you might have some of these extra bone spurs or little tiny tears in the tendon. It seems scarier than it really is. This is just a normal part of the aging process. And so this is not to worry about at all, but it is one of the main reasons of people over the age of 40 and into their 50s begin to get shoulder pain because there's space, this space here shrinks down and there's just less room for error. So it's really important to make sure that these rotator cuff muscles behave the right way and they do their job. So with shoulder impingement or a rotator cuff injury, one of the main complaints is they can move their arm up, but there's just a certain spot where it hurts. And sometimes it gets better afterwards, or sometimes it continues to hurt. Or maybe when you reach out in front, it begins to hurt. It's okay by your side, but once you get up overhead, that's when it seems to bug you a little bit more. Another one is when you reach across your body, that can be irritating. And what's happening is that ball and socket joint, rather than staying perfectly in the center, what happens is it's getting pushed up here a little bit. And like I said before, once you correct that, then the majority of the irritation should go away. If we add some muscle layers here, what we find out is some of these other muscles like the deltoid and upper trap, they also perform some of the same actions as the rotator cuff muscles. So if there is a weakness in the rotator cuff itself, what can happen is these bigger muscles start to take over the action, but they don't do quite as good of a job at it as the rotator cuff. So if you are someone who has pain when they raise their arm up, one of the first things you want to do is get your range of motion back in a pain-free way. And one of the ways you can do that is by doing what we call active assisted range of motion. You can get a set of pulleys, or you can use a broomstick or a golf club and grab onto it, and then, here we go, and then push your arm up in a pain-free area. Don't ever force your shoulder up into pain, because pain is like a check engine light, or it's telling your body that something's going on. So just move it up and then bring it back down. And an active assisted motion has the muscle do a portion of the work, but not all of the work. This is one of the better ways to restore range of motion at home. As that improves, you can always start with isometric exercises. Isometric exercises is when the muscle contracts, but it doesn't get shorter or longer. It just contracts on its own. And there's a lot of great exercises that you can do. If you have any questions about those, just drop me a message in the chat and I'll get them to you. Once you can do isometric exercises and it doesn't bother your shoulder anymore, then you can advance and progress to a more dynamic shoulder strengthening program where you have your arm up, or you're strengthening in the motion to make sure that that ball stays right in the center of the socket, just like that. So just a brief recap is, if you've developed shoulder pain over a long period of time, one of the most common reasons that is because that shoulder is just pinching or pressing up against the roof of the shoulder joint. So my at-home recommendations are, if you have shoulder pain, throw some ice on it, about 10 minutes at a time. Anti-inflammatories, whatever over-the-counter anti-inflammatories your general practitioner recommends for you, whatever it says on the bottle, you can help that to bring down the pain. Restore the range of motion first, and then start to do isometric exercises, and finally you can transition to a more dynamic strengthening program. And if you have any questions on any phases of what you ought to do, just send me a message and I'll get back to you immediately so we can help you get back to where you were before you hurt your shoulder. I hope you learned a little bit, or I was able to shed a little bit of light on shoulder pain for you. So thanks for watching, and we'll see you next time.